So good afternoon. Welcome everybody to this webinar organized by ESSO. Today we have the opportunity to have a webinar organized together with the UMS Division of Surgical Oncology, and the topic will be the exam of surgical oncology, the EBSQ certification exam. And I'm happy here to moderate. I'm Marco Fiore, surgical oncologist in Milan. I'm a board member of the ESSO Society, and I'm honored to moderate today with Nada Santrak, that is also with me in the board members. As you saw in the video, ESSO Society has a number of initiatives and education is among them. For members, we also have the benefit of having the European Journal of Surgical Oncology, and obviously the UMS exam in surgical oncology is one of the initiatives that ESSO is supporting, particularly in preparing the exam in terms of quality, scientific qualities, collaborating directly with UMS since a long time. I would like also to advertise for all of you that are interested in the exam that there are some other opportunities in education from the ESSO activities. You can find it on the ESSO website, especially the ESSO course on basics oncology for surgeons that will be held in Sofia in coming months, and obviously the annual congress next year, this year will be in November in Madrid, and this is very important because usually the UMS exam of surgical oncology is held in connection with the annual congress the day before or the day after at the meeting. So just stay tuned on our website and also on the website of UMS to be updated on the day of the exam if you are here today because interested in the exam. So I thank you all again for the participation today, and please, Nada, if you want to introduce our speakers in the program.
Thank you, Marco. Hi from my part as well. It is a pleasure to be co-chairing this webinar. As Marco said, my name is Nada Santrak. I work in Belgrade at Cancer Center in Serbia, and I'm also chair of Young Surgeons of ESSO. So in that context, I'm happy that we were able to organize this kind of webinar through ESSO, and I thank ESSO for the opportunity to introduce our certification exam, which is really important. And I hope that after talks of our two excellent speakers that you will have more information about the importance of this certification and how you can maybe advance the application and prepare yourself better. At the end of our two talks, we will have an open floor for questions. You are free to write in chat and also in questions and answers section. So please ask whatever comes across your mind. Our two speakers today are my dear friend and also former Young ESSO chair, Andreas Brandl. He's a surgeon working at the Department of General Visceral and Oncological Surgery in Hospital Northwest Frankfurt, Germany. And he will give he's also the co-chair of ESSO Education and Training Committee and the chair of Research Academy. So he has a lot of experience, personal and professional, with every opportunity that ESSO is offering to its members. And I hope that you will get answers from him that you require. Andreas, please, the floor is yours. Introduce the certification and maybe give more insights from your personal experience.
Well, thank you so much, Nada. Also, thank you very much, Marco and Maria. It's a real pleasure for me to be in this webinar with you. I'm looking forward and I'm excited to have a very interactive webinar with you. Wolfgang Tasler is one of the major figures, of course, in this European Board Surgical Exam, not only in Germany, but also in Europe. And I'd like to share more insights from a person who also did the exam a couple of years ago. And I will show you some insights and also learnings that that I had. Let me just check. Okay, so I hope you can see the slides. And first of all, I have no conflict of interest to report. I have no financial relationships. My only conflict of interest is that I took the exam back in 2018 in Budapest at that time. And I joined last year also the examiner board of the German Society of Surgery, the Surgical Oncology section, and also within ESSO. And your question for sure is why should we do that exam? And I hope that I can answer or I can provide at least my answers why I did it back in 2018. So I have been roughly 12 years in my career, 2018, and I decided after getting the board exam in Germany and also the sub-specialization that we can have in Germany to become a special visceral surgeon, I decided to go on this path to learn more about surgical oncology. I've been associated with ESSO at that time for a couple of years, and I thought surgical oncology, this is something I want to grow, I want to learn, and this was my motivation to do so. Another motivation at that time was that I was thinking about changing country. And as you know, in Europe, we have certain rules and also automatic recognition according to the Schengen commitment. And I thought surgical oncology is something that adds to my profile, makes me maybe more recognized in the way that I see surgery. And this have been my key motivators at that time to do the exam. But about the exam, you will learn more also in the next talk about the details, how to apply and how to study and train for the exam, what requirements we will have. To tackle the elephant in the room, I like just to share some citations from a Cancer World article that has been, I think, published more than 10 years ago. And you know that surgical oncology is not a new field and is actually quite an old field and has been the first unofficial fellowships for surgical oncology in the US lasting back until 1947. So it's not a new topic, it's an old topic actually, but we are still in I don't want to say fights, but we are still working on getting it recognized all over the European countries. And as you know, there have been some surveys in the past about the recognition of surgical oncology. And to be honest and frank, it is not recognized in the majority of the countries. So we are still in the progress, and of course within the power and force of ESSO, but also other societies, we are moving forward to get the recognition. So you see here other citations that it's very difficult and that many specialist interest organizations are competing. And this is something certainly that is happening. But nevertheless, I don't know if surgical oncology is a mission impossible to become true in the European countries. And I would like also to show you an example of Germany that in the last 12 months has been doing major steps in the recognition of this specialty. I would like to share like 2-3 slides of history with you about where this OEM certification surgical oncology comes from. So it has been the first core curriculum of ESSO has been created back in 2003, and we had an update in 2021. And there's an oral exam, and there are some requirements that you need to fulfill, a logbook, and also a written exam. But I don't go into much details. You will hear about this later. And you see here that the core curriculum is something which is very much attached to this European board examination, as we from ESSO have been updating what is necessary to learn, what are the important topics. This is changing over the years and decades. As you know, we are progressing with new therapies, new trials, and so on. I was wondering how many surgical oncologists are recognized or did the exam in Europe or also abroad so far. And I was doing some maths because you can see this also on the UMS surgery webpage. And I found until today, but I have to admit that the numbers from 2025 are not completely updated yet. We have 295 of this FAPS surgical oncology. And you see from 2008, there were small groups of 8 people in The Hague and in Berlin and in Bordeaux. And then it started to become more popular. And I think also one very important breakthrough was that the English exam has been also transformed to different languages. And there was the first group in 2019 in Wiesbaden, where 11 participants did the exam in German. And so it became more popular in Germany. And you see that in Germany we have now exams on an annual base. We had them in 2021, for example, also twice. And this is not the only country. We also have other languages that we offer. But you see all over, we have now like per year 25, maybe 30 or 35 candidates who are passing the exam. And Wolfgang will also tell you that not everybody will pass the exam because it's also, you have to study hard on this, and it's a challenge, I can admit. So today, if you go on the web page, you see that practically there's a written exam, and this is just to highlight. I don't want to go into details about the application or dates, but you see that we have English, we have Spanish, we have French, Italian, Portuguese, and Dutch in the exam, not only in the written, but also in the oral exam, which usually happens on the ESSO Congress on the day after. I would like to share the example of Germany, because when you do research on this surgical oncology, it's not very easy, because not many things are published on this topic. But in Germany, I can also share from my own experience. There's an association of surgical oncology, which we have now also made the progress exists in many countries. In nearly every country in Germany, we have surgical oncology subsections or associations of the society. And you see here that the German initiative was that not only they prepare for the exam in a way of recommendations, but we took it seriously, and we made a whole curriculum about it. Also a little bit like ESSO did that already many years ago. So it was not only to study and to give some advices which textbooks you can use, but also you have to attend 3 courses, which are recognized courses for surgical oncology in the country, organized by the German Society of General Visceral Surgery, and also linked to kind of a mini fellowship. We call it hospitation in Germany, that you go to a cancer center to get also the experience in case you don't work in a cancer center, but also for the persons and the candidates who were working in cancer centers to broaden your view. You always learn a lot while observing or going to different centers, and this has been also a crucial part of this curriculum for surgical oncology in Germany. And then similar then in ESSO, you can choose 2 main fields for surgical oncology out of colorectal, sarcoma, peritoneum, upper GI, HPB, and so on. And then you go for the exam in written, and the oral exam is in German then during the autumn Congress of the German Society of Surgery. So this is something that has been now established for a few years, and is running very successfully in Germany. When it comes to centralization, I'm also very happy to share a development in Germany, which I would say, please correct me if I'm wrong, Wolfgang, this is kind of a breakthrough in a very long-lasting effort of work of many people. And in Germany, we have, as you also have in other countries in Germany, we have certification processes for cancer care. And the certification processes are run by the German Cancer Society, the DKG, and they are certifying centers with expertise. So you need to fulfill many points, not only the number of surgeries, the quality of surgery, complication rates, discharge, length of stay. So a lot of quality markers, but not only the surgical treatment, but also the gastroenterology and all the other disciplines that are helping in the treatment of patients with cancer, medical oncology, radiation oncology, of course. And this certification is kind of a brand. If you get this, you're able to treat cancer patients with the highest quality standards in the country. And I don't want to go too much into politics, but this is also now a way where centralization is going to happen in our country, in Germany. So it's a very important certification for the treatment of cancer patients. And just last year, the qualification to become a surgeon in a certified cancer center has been called in Germany special visceral surgeon. So this is a qualification that you can achieve after more than 3 years after board certification of a general surgeon or visceral surgeon. And then you can apply for the recognition. You need numbers of major cancer surgeries there, like esophagectomies, hepatectomies, pancreatectomies, and so on. And this has been now recognized for the German Cancer Society as equivalent as the FAPS surgical oncology. And this is something which is a major achievement in our country because it shows that the FAPS surgical oncology is recognized for choosing the surgeons in the cancer centers, in the certified cancer centers, for your qualification. And as you will learn also in the next talk, what is important, operative numbers, and so on to obtain this FAPS. This has been a breakthrough last year, and that makes some things more coherent in our German landscape, I would say. Just, I think 1 week ago, I received an email, as all the members of the German Society of General and Visceral Surgery, about the term surgical oncology. And this has been now confirmed by the Association of Surgical Oncology, that participants, as I described you in the last slide, who go through the curriculum in Germany and to go for the exam in the German society, they can add the name surgical oncologist to their specialty. So you see, even if that might see many steps for you, this has been now important steps in Germany for the recognition of this specialty. And this is just as an example. And as I already said, when we come to the national societies, I just saw some figures in which year certain countries have a surgical oncology subsection. So in Germany, it was 2017. The Netherlands, for example, they had a subsection since 81. So many countries are progressing. Some are very early, some are a bit later. And at the moment, I think we have like 26 or 27 countries in Europe with a subsection of surgical oncology embedded in the societies of surgery. So this is a little bit of the information from my side, and you see that we might have the times of wind of change, and I'm of course waiting eagerly that the surgical oncology will have a better and bigger and importance in the treatment of cancer patients. And I think also with the European Beating Cancer Plan, this has been quite focused during the last years, also from a policy-making perspective. And with this, I would like to conclude, and I'm happy then to have the question and answer after the next talk. But surgical oncology sections in societies are commonly established. There are only a few countries missing them so far in Europe. surgical oncology as a specialty is mainly not recognized in the countries yet. I gave you the example of Germany, where we have several steps in certification processes where the FAB surgical oncology is now recognized, and that's a great achievement. And we have some countries doing similar steps at the moment, and I'm looking forward to share them in the near future with you. And with this, I'm happy to end this talk. And as you already heard from Marco, if you're interested to go to Sofia, I've been there last year as a part of the faculty. It's a great course. You learn a lot about basics in oncology, not only surgical field, but also from very experienced radio oncologists, medical oncologists, and so on. And if you have the time on these days, it's definitely worth to go for this course. Thank you so much.
Thank you, Andrea. Thank you. Very interesting and comprehensive review of the situation of surgical oncology. I just take the occasion before introducing Wolfgang to remind you that we have a question and answer session in the end, so you can use the Zoom question and answer. We are already collecting some questions and we'll reply in the end. So please take the opportunity for this. So now it's my pleasure to introduce Wolfgang Tessler. He's a surgical oncologist in Red Cross Hospital in Munich, and he's also deputy chair of the UMS Division of Surgical Oncology, that is the body who is actually organizing on a practical part and running the exam of surgical oncology. So we ask Wolfgang to introduce you to the mechanism of the exam, how to apply, how to manage to get successfully clear the exam, and if there is any tip and tricks on this side for you. So please, Wolfgang. You are muted, so we can't hear you. And now it's perfect.
Dear Nada, dear Marco, thank you very much inviting me to this webinar. I would like to use my introduction to encourage all of you for this qualification and explain a little bit my history, why I'm sitting here today, and what was my story. I started surgery 30 years ago as a young fellow or a young resident, and then becoming an attendant. Motivation was to find possibilities to get into specialized qualifications. And at first I detected this UMS format for coloproctology. So because coloproctology was offered in the National Congress in German language, and it was a mixture from oncologic colorectal surgery and proctology, which is still unique. So I did my first FABs in coloproctology. I have to count almost 15 years ago. And then kind of focusing on this field of surgical oncology, because all these quality initiatives guided by the German Cancer Society or my motivation was to get qualification to be a relevant discussion partner in the tumor boards. So I detected surgical oncology and did this surgical oncology exam, and then I was kind of within ESSO, and at the end I found myself in the division of surgical oncology. In the meanwhile, running this exam together with all the other engaged people there, and also implemented in the German language this exam, because I'm convinced we have to promote these exams on a national level. First of all, I would like to explain a little bit what ESSO what UMS is meaning, and I would like to share a couple of slides for that.
Yes, we see your screen, Wolfgang.
Can you see my slides?
Yeah, try to scroll. Yeah.
Okay.
Perfect, perfect.
Okay. So I was very surprised to learn that UMS was an initiative of private practice, and doctors all over Europe, in the meanwhile, 41 national medical societies all over Europe decided to have a qualification which is kind of international or European-wide accepted. And this lasts until the early 60s that UMS was founded. And the first specialization was from the anesthesiologists. Perhaps they have the highest mobility at that time all over Europe. And then a lot of different sections within the UMS were founded, not only surgery, but surgery was the driver. Very interesting, actually, within all these activities in the UMS. And in the meanwhile, as you can see, there are more than 40 sections within the UMS, and a wide range of qualifications. And under the umbrella of surgery, also a lot of qualifications, and surgical oncology is one of them. As I told you, my first qualification was coloproctology, and in the meanwhile, also, for example, which is not listed here, abdominal wall surgery with the specialization of hernia. So hernia surgery is also one specialization. And then there are also multidisciplinary joint committees to have special qualifications for creating and developing different fields, highly specified qualifications under the umbrella of the UMS. And there's also in the quality management a huge range of activities. So to jump over this, surgical oncology lasts more than 20 years, also very much embedded within the European Society of Surgical Oncology. And in the past and also in the present, there's a high overlap between ESSO and UMS. But UMS is the body who is responsible for the exam and also the qualification. So Andreas Brandl already showed you the current application date. So it's the 10th of March. I think since 1st of January, the Quiz 1 platform is open. And then we will have an online written exam where you can sit in your office or at home with your computer and a second device to participate on the written exam for 2 hours 60 questions, and everybody who will pass the written exam is then invited for the oral one, and the oral one will be held in the German Visceral Society conference at the year in Hamburg, the 16th of September, and the international, the English, and if there are enough participants, candidates in all the other languages, so there's a cutoff, at least 4 candidates, for example, in Spanish, French, Italian, Portuguese, or Dutch, have to come together, that we are able to organize in these languages the exam. Will be within the ESSO conference that time in Madrid. In 2025, it was in Göteborg, and as Andreas explained, we implemented since 2018 the German exam under the umbrella of the German Society of General and Visceral Surgery and the Association of Surgical Oncology in Germany. So now a couple of words to the eligibility. There are some formal issues that you have to have a license to practice as a surgeon at the time of examination. You have to be, what the goal behind this is, that you have to be an active surgeon. And surgical oncology is in the surgical activity a very broad field. So nobody can cover all the different surgical specialties under the umbrella of surgical oncology. That's the reason why surgical oncology specifically does not have fixed numbers of procedures. It is about that you have to show in a logbook that you have a training in a surgical oncology field, and there are different possibilities. The name is Oncological Center specialized in surgical oncology, and then at minimum 3 years of experience. This is actually almost equivalent to this format of visceral surgery, which we do have in Germany, or 1 year as a surgeon in a recognized oncological field, or surgical oncology research fellowship plus 2 years in a clinical field. So it is also, as you know, the exam has also an academic part. Then, so the academic surgical oncology is of importance in this eligibility. And a CV is kind of a mirror of your development. And still, there is a logbook format. This logbook format is all over the other divisions the same, where you have to state in 3 different categories: first assistant, principal surgeon assisted by a trainer, and principal surgeon not assisted by a trainer. And then you have to list all your procedures over the last 3 years. And this has to be proven by your trainer. And then there's also a declaration where 2 of your mentors, trainers, have to state that you have kind of the recommendation to become a surgical oncologist. The written part, as I mentioned before, 60 questions focused on general oncology. This is from the past where everybody was sitting in one room. In the meanwhile, everybody is sitting at home. And the written exam has a broad field of surgical oncology, so breast, melanoma, skin, endocrine, colorectal, also peritoneal surface malignancy, upper GI, HPV, sarcoma, and general oncology. And normally the 60 questions are reviewed before they are rolled out in the written exam, and then a score is asked, and then from the score and the result of all the applicants, a cutoff will be calculated. So pass rate is between 60 and 70%. So there are some failures, and if you pass, you will be invited for the oral part, either in native languages or in English. And it is focused on first a clinical evaluation where cases are prepared also with perhaps videos or other material, where two of the examiners discussing with you clinical cases, and you should show that you can manage this clinical case properly according to international guidelines. And there's also an academic part. You have the opportunity to read 2 papers within 1 hour, and then discussing the papers with the peers. And it is also not only focused on the content of the paper, but also on the quality. And you should understand how to read a paper and how to interpret a paper. This is something you should show. So that's from my side a short overview, and I think you have a couple of questions on this, so please be free to get back to us, and if later on, please write me an email to your details.
Thank you, Wolfgang. So we have a number of questions now in the both in the chat and in the question and answer. I would ask you, if you have more questions, to use the question and answer so we can focus on that one. Nada, I don't know if you want to start going through the questions for the speakers.
Yes, let me read to start with the first question from Jonas Herzeberg, who is asking about the logbook. Is it only surgical procedures regarding to oncology, so oncological, or all surgical procedures?
So you can list all the procedures, because if you do colon resection, either by inflammation or by oncological cause, it's technically almost the same, but we are focusing on oncological cases and procedures. So
okay.
If you
another question from Zoltz is whether there is any bibliography for the exam to prepare.
What is missing?
A bibliography to prepare the exam.
So on the website, either on ESSO website or on UMS apps, there are examples, And curricula you can prepare, but there is no detailed book, especially for the exam.
There is a manual that was published by ESSO some years ago that was somewhat covering the curriculum, but I mean, there is not a specific bibliography only directed to the exam. So
this could be for Andreas, maybe, and also
yeah, sure.
When is the earliest time to present the FEBS examination after having probably the exam in Germany, right? Fachkart für Visceralchirurgie. I'm not speaking German. Andreas, help out here.
Yeah, and same question is what is the recognition status of FEBS? So what it comes with the FEBS recognition, Fellow of the European Board of Surgery?
Maybe if I can answer that first question regarding the Facharzt für Visceralchirurgie. I think it is, as it is now also from the German Cancer Society, it is an equivalent for the special visceral surgery. So that means after your board exam of 6 years, you need another 3 years at least to practice surgical oncology. And I think that is the earliest. When it comes, of course, then to the numbers of resections, I have to say that from the logbook, I think there is not a certain number which is mandatory, but it seems so that you need a couple of years. So I would say roughly like at least 10 years in surgical training, or at least 4 or 5 years after the board exam.
Okay, so and what is the recognition status of FEBS? Wolfgang, maybe you want to comment on this?
Can you repeat the question,
so
please?
What is the title of FEBS? What is coming with this? If you get the recognition of a Fellow of a European Board of Surgery, which is the advantage?
It is a special qualification which is accepted all over Europe. As we know, qualification is normally organized on a national and a federal basis, but the future is, in my opinion, that national organizations will more and more accept these international European exams for their qualification. Andreas showed the example for the German Cancer Society, for example. It's not only surgical oncology, also the others, HBB and coloproctology is accepted in specific necessities in their qualification process. So it is an accepted qualification.
And maybe related to this, Fernando is asking for a surgical oncologist in Latin America, for example, in Argentina, what would be the benefit of taking this kind of exam? So they have their own title of surgical oncologist. So is there any benefit in running an exam in Europe? Or this is only for European surgeons?
No, it's international. It's up to you. You can do an exam in United States within the American College of Surgeons. You can do this exam in the British system. That's up to you where it is more appropriate. I think the European exam is the less expensive one.
I think you're right.
You think, yeah, because there is a question also for this. There is someone who asking why, it is so expensive the exam. It's too expensive. There is a question about this.
I already answered in written. It is a self-financing system. So UMS is not. It's not supported or co-financed by other institutions. For example, on the national side, it is embedded in the board of medical qualification, but it is supported by the membership fee. This is not with the UMS, so it is self-financing.
There is a question again about the logbook. Mihai from Romania and Sebastian Blaj are asking similar questions. So regarding those procedures that you need to record in the logbook, do you only consider last 3 years, past 3 years? And in addition to this question, is it possible to use procedures that you have been doing 10 years ago, although you're not active anymore in a large clinic?
So 10 years ago, so we would like to have surgical oncologists in a present. We cannot prove history. So, but I think it is a whole picture what you have done, and it is always of opportunity to show your whole experience, even if experience is shifting. But there should not be a lack of active surgeon life. Yeah?
Certainly, they should be clinically involved still if they're taking tests. I mean, the examination. But anything in the past counts as an experience, which is important to note down in logbook. There are also questions about acceptance of FEBS in Ireland and UK regarding the prospect of working as a specialist consultant. Do you have information about that for our Asfia was asking?
This is always the issue in every country, and you have to ask your national site how they will accept. Yeah, and it is not UMS, and in combination with ESSO is offering a platform, so which a very standardized, well-established, and recognized qualification. What your specific...
Sorry, Wolfgang, but I mean, Ireland and UK are part of the UMS, isn't it?
Sure.
So the title is recognized. The point is whether you can get a benefit in your career or in your selection process, for example, for a post. This is really dependent, but for sure, the title of FEBS give you a sort of certification of your the level of your preparation. So that's on a personal on a personal side. I mean, this is not on a system based. I don't think that. I mean, in Germany is more system based, the recognition of the FEBS title. Otherwise, in my understanding, in the other countries, this is more related to the quality of your CV when you are presenting for a selection. Am I wrong?
Yeah, and I think, if I may add, maybe I think it's always then an individual decision if a country recognizes your certificate, right? In Germany, we are now lucky that it is recognized for the certification process of the German Cancer Society. But just from a personal example, when I moved to work in Portugal, they did not recognize my specialty automatically that I had in Germany because they have a different system. So I think you need to try. I mean, if it might differ to, let's say, a general surgery or a board exam in some countries, but maybe they recognize that. So I think it's then always an individual, but at the moment, there's no automatic recognition.
Let me ask a question, so if I might, as somebody who is coming from non-EU country, but European country. Well, since it's not something that is practically relevant for us, still from Serbia, if you go to Germany, you should still start with surgical oncology or general surgery all over again. It's not recognizable diploma, like from especially diploma from Serbia. But I'm not sure if I would take the certification through UEMS. Would it be any? Would there be any benefit from me, or I should still be there and start all over with surgery? If you know what I want to ask. That these FEBs in any way useful for us outside European Union, because in the European Union everyone can shift work from Germany to Spain and I don't know, France, and you're still a surgeon. If we come from Serbia or Bulgaria, or okay, Bulgaria is now EU, but for example Bosnia, you're not visible as a surgeon. So Marco or Wolfgang or...
Marco, will you give it a try?
What about non-EU people taking examination? Is it useful for us? When
that's what I was commenting before. So for sure, it's really useful for your own CV. We have we had in the past year a lot of applicants coming out of Europe, from the Middle East, for example, and from European countries that are not in the EU. So there is a lot of people who certified with the surgical oncology exam. So then what happened to your career, depending where you are staying? This is not a card to be licensed in Europe as is. You are required to get this exam if you're in Germany in this moment, but not for the other countries. But for sure, I don't know, we have many applicants, for example, for Egypt, from India, and for sure in their countries, this gives them a sort of visibility and a sort of priority in the referral centers, in the big cancer centers, and it can be a start for a brilliant career then in the future, obviously. So I think that it's a kind of certification of the level of your preparation. This is not for all, for sure, because there is a big selection process, as Wolfgang previously described. I mean, not all the applicants are passing the selection process on the curriculum. Not all the applicants are passing the written exam. And I would say not all the candidates are passing the oral exam in the end. So I don't know if you want to comment on the Wolfgang on rate of success in this exam. We had also a question before of an applicant who failed maybe twice the oral exam. You can retake the exam, obviously. But I mean, in my experience, so the level of the certification is kept very high. Is kept very high, and this is a sort of guarantee that when you get the title, it is a title that is really representing the quality of your training and your practice. Wolfgang, which is the rate of passing the exam?
It depends. It is for the written exam from 10 to 30% failure rate. And for the oral, it is perhaps 1 or 2 of 10, so 10 to 20%. And it is very different from year to year. And what we can see that how candidates are preparing, at least for the written part. Good preparation will end up in good results.
Yeah, I can just echo that. So when I took the exam, you of course are asked questions from the broad field of surgical oncology. So maybe I was not familiar with breast cancer patients or maybe gynecology cancers. So I would strongly recommend to take really some time to prepare it properly to avoid failure, because it's quite a lot, and I think that also echoes what Marco said, that if you get that exam and that FEPS title, it really shows that you worked for it, and it's a recognition for your work.
Absolutely. What I wanted to emphasize, although us from non-EU countries don't have practical benefit regarding career launch or something like that, still you get knowledge, experience, you get a very important personal and professional benefit from going through all this procedure that you have went through, Andreas, for example, the learning all other fields maybe of surgical oncology that you're not very familiar with, then the examination itself, the experience, the contact with the examiners, and all that in the end gives the benefit, although there is no practical on paper benefit regarding the career launch or something like that. Although there is the best benefit for those who work around Europe in the EU, because it gives you freedom, like a pass that you can go from one country to another and work freely as a qualified surgical oncologist, right, Andreas?
Yeah, I would say it maybe more philosophically. I think the journey is the goal somehow. I think it is true for many things in our career or in our life. In the end, if you want to become a surgical oncologist, if you want to become a professor or so, it's the journey. And during the journey, and if you visit other centers, which is mandatory for the FEPS, you will get to learn more people that are like-minded as you. And that is growth, I would say. So
yes,
one thing is the title, but the other thing is what you are doing to receive this exam and to pass the exam. And I think this is the learning and the growth that we go through. And that, I would say, for my personal answer, is a benefit.
yes, absolutely. That's what I wanted to underline.
I'm just looking at the chat because it's quite difficult to follow. There is a lot of questions here.
Yes.
So just a question, if we plan to have an exam in Turkish, native language Turkish, Wolfgang.
To answer it concrete, if there are enough, if there is a national initiative who wants to promote this, and if there is a demand in numbers, it could be also established in Turkish language. But this is something which has to be driven by the national surgical oncological societies.
There are more questions. You're answering some of them directly, right?
Yeah, so maybe there are some questions, Wolfgang, how to apply. So if you can repeat some clear indication for the process of application. So where
I
to
just
go?
realized, because there were some questions I already answered written, that the link for quiz 1 disappeared. I will take care over the weekend that the link will be on the UMAS Division of Surgical Oncology webpage that you can apply for.
Okay, so the indication is, let's go on the website of the UMS, find for the division of surgical oncology as a specialty, and when you are on the webpage of the surgical oncology division, you have to look on the page of the examination. And then the link is supposed to be there. And actually, you're right. I'm just looking at the page now, and the link disappeared, but it's supposed to be there. So we will fix it over the weekend. Correct? and we will remind the application deadline, that is March 10. Just be aware that you would take into account some time before the application, because preparing the form of application is quite time consuming if you have to prepare all your list of your surgical career. So don't do it last minute. Okay, so it's 6 o'clock. I don't know if we forgot some important question. Nada, can you help me for this? Otherwise, we come to the conclusion.
Some questions, but we already addressed them. What is the literature? What references should they use to prepare for the exam? What type of questions are there? As I understood
yeah, there were also questions about how to prepare in terms of courses. There is any specific course. I don't know, maybe this can be commented by Andreas. So there is not a specific course for this exam, but there are a lot of courses and resources also within the ESSO of educational offer, isn't it, Andreas?
Yes, thank you, Marco. Well, we have several courses in ESSO that are mainly structured in basic and advanced courses. So as this European board exam is advanced, I recommend to have a look on the website to see if there are specific courses interested for you. The course in Sofia now that we already advertised is a basics in oncology. It's not a specific course for repetition, but it gives you a broad overview, maybe to refresh your knowledge in certain medical oncology or the radiation oncology topics that might be also part of the exam. But there's not a specific preparatory course for the exam, but I think the advice that you heard tonight with specific books or also preparation is useful. And if you have any questions, I'm happy also, if you send me emails, I'm happy also to answer in the future.
Okay, so thank you. So I think we did it great. And I don't know, Nada, if you want to conclude.
Well, yeah, I would like to thank all the speakers, both Andreas and Wolfgang, for excellent presentations and sharing valuable insights into how to apply, how to prepare. I think through your presentations and also the answers, you have answered practically everything that is useful for the whole process. And also I would like to thank Marco for especially proposing this webinar, because he had desire to inform young people that are members of ESSO on the opportunities that ESSO is sharing regarding this certification. And I think we did something very useful. Thank you for the proposal. Also, thank you to ESSO for making it possible and organizing, thanks to the staff. And I hope that we will have more useful webinars like this. Marco, last is yours.
No, I just want to thank you, all of you, to have participated. I mean, I'm very happy that there was many people interested in this, and I also want to give a special thanks to the ESSO staff, because they really helped today. And thank you, Wolfgang. Thank you, Andreas. I don't know if Wolfgang raised the hand to say goodbye, or if you want to comment again.
Yeah, thank you very much for the ESSO initiative, also kind of to promote improving surgical oncology under the umbrella of this exam. I have to apologize that the link is not working at the moment. Application deadline is the 10th of March. So I will take care over the weekend that the link will be open next week. So
we trust your promise. We trust your promise, Wolfgang. Everyone will check this on Monday.
Yeah, no, I didn't promise on Monday. At least
over the weekend. So
yeah. Okay. So
okay.
Sorry.
So thank you, and have a nice evening or night wherever you are, because I saw people from all over the world actually attending. Bye.
Yeah.
Thank you.
Bye.
Thank you. Bye.
Great. Thank you, everyone.